What are the pros and cons of lumbar disc replacement? The pros are pretty clear again, similar to the neck. You maintain motion. It's for people with diseased discs or degenerative disc disease, with back pain and back and/or leg pain. And by replacing a bad disc with an artificial disc, and these discs often last 70 years, you're able to maintain mobility and get pain relief. And patients are looking to preserve motion today. So the pros are very clear and obvious. The cons being, you might not be a great candidate. What if you have really arthritic facet joints? Something like that could still cause some pain in your back if you just replace the disc. I will tell you that we are doing patients with more and more arthritic joints in the low back and in the neck than we did in the beginning, and the outcomes are still better than fusion overall. But the cons can be core failure, infected disc, but those are exceedingly rare. We rarely see those in the lumbar spine, similar to the cervical.